So what we're going to do for Michael is we're going to take out his tonsils, but Michael, we're going to take a look at those tonsils again with this cool new MD scope we have. Can you open super big for me? Big as you can. That is fantastic. Good job. And back there, that's his uvula in the center, and on the side, there's one tonsil and the other tonsil, and there is very little space back there. Fantastic. Okay.
So those were those little meatballs we saw, right?
Those are those meatballs back there. And this is another example we have of some other meatballs. This is obviously a much larger mouth, much larger than yours, Michael. And this is a very large tonsil here, and this is a normal tonsil. So you can see that this tonsil is taking up much more space. And what we do, I wish it were this simple, we just take out the tonsil. And there's more space in the back of the throat, and then he could breathe. You can see Michael has a little bit of a stuffy nose today. He always has a bit of a stuffy nose because his adenoids are enlarged too. So next week we're going to be taking out both his tonsils and his adenoids, and after that he will be sleeping through the night quietly.
Awesome. And how do you do a tonsillectomy now?
Well, there are lots of ways to do tonsillectomies. This tonsillectomy is one of the oldest procedures in history. The newest technology is something called coblation, which is a radio frequency, very cold temperature, more advanced than a laser. And you can see here that we're just taking out a tonsil very gently. There's no bleeding during the procedure. It is very quick. The instrument that you can see is giving off some cold salt water, so it's cooling the tissues. The tonsillectomy itself takes several seconds to do, less than a minute, and it's done, and the breathing is better. We do it on the other side.
So tonsillectomy has really come a long way, hasn't it?
It has come a long way. Most kids go home on the day of the surgery. Most kids are eating dinner that night. Most kids are back to regular activities in a couple of days. And he can still have ice cream, but it's not as bad as a sore throat as it used to be.
Well, that sounds good to me. Well, we want to thank Dr. Shapiro, Dina, and especially Michael, who in another week will have all the ice cream he can eat. Save some for me.